Gary, you ready? Welcome to the University of Tennessee Nuclear Engineering Department Colloquium Program. My name is Lee Dodds, and it's my privilege to introduce today's speaker, who is Dr. Doran Christensen, who is the Associate Director of the Radiation Emergency Assistance Center and Training Site, which is called REACS, which is part of the Oak Ridge Institute for Science and Education, ORIDES. Dr. Christensen received a Doctor of Osteopathic Medicine from Des Moines University in 1975, and then he joined the U.S. Navy, and he was in the Navy practicing emergency medicine with the Navy from 1976 to 1979. And then in 1979, he began another practice of occupational and emergency medicine with several different companies, including the Newport News Shipbuilding Company, Ford Motor Company, and the U.S. Postal Service. For the last 12 years, he was the medical director for the U.S. Department of Energy at the Fernald plant. And then in May of 2004, he joined ORISE in his current position. The title of his presentation today is A Review of Significant Radiological and Nuclear Accidents Since 1944. Ladies and gentlemen, please welcome Dr. Doran Christensen.
Thank you, Professor Dobbs. Thank you for having me. Good afternoon, ladies and gentlemen. This talk I'm going to give this afternoon is usually a 2-hour presentation that we give to doctors, nurses, emergency physicians, emergency medical technicians at REACS, and because of its complexity and the scope of it, we have to give it in 2 hours, and that even is too short to really discuss the medical consequences of various types of radiation accidents. So let me begin by just telling you what REACS is, and we'll go on to what defining a radiation accident as it's defined internationally by the International Atomic Energy Agency and the World Health Organization. We'll talk about various types of injuries and illnesses caused by radiation radioactivity. We'll talk about some of the sources that can cause harm and how much harm they can cause and where do the accidents occur. REACS is a 24/7 Department of Energy emergency response asset. We're on 4 hours notice for national events or 6 hours call for international events. We have physicians, nurse paramedics, radiobiologists, and health physicists on our staff. We're also on call 24/7 for medical consultation and dose assessment consultations worldwide. We also coordinate the use of DTPA for chelation of radionuclides of plutonium, americium, and curium. We also maintain the use or manage the use of Prussian blue for radiocesium and radiothallium as well as thallium. We maintain registries of accidents worldwide going back to 1944. Let's talk about radiation accident. This is defined, originally it was defined as an unintentional event involving overexposure or contamination of persons or the environment. Obviously, since 9/11, that has had to be changed to an unforeseen event because we've had the threat of a nuclear weapon being delivered to the United States. So if it does occur, it's going to be an unforeseen event. Unfortunately, because of the mysteria of radioactive materials, radioactivity, and the basic fear that many people have of radioactive materials and radioactivity, exposures may be real or suspected more so than with any other kind of toxicant in our environment. Let me look at the dose criteria for designation as a radiation accident. These are again international and Nuclear Regulatory Commission guidelines for dose to the whole body, dose to the skin, dose to other tissues and organs. Internal burdens are defined as a basis on half of the NCRP limits. And medical administrations are defined as you see here, as a burden of radiation source, burden of a radiopharmaceutical or a dose from a radiation source. Now these criteria are clearly, from my point of view, do not necessarily mean a whole lot medically. However, there has to be a regulatory limit, so these have been imposed, and accidents as per this definition is how they are included in the REACT's registry of radiation incidents over the past 60 years. Human exposures to radioactive materials can cause acute radiation syndrome, which is a spectrum or we'll say a spectrum of medical or clinical findings related to blood-forming organs, the bone marrow, the depletion of lymphocytes, which are responsible for the immunologic integrity of the human body. We'll see that there's the cutaneous radiation syndrome. There's the gastrointestinal syndrome. It's a spectrum of injuries that begin of damage that occurs down as low as 5 to 10 rad. We'll talk about local burns. We'll talk a little bit about contamination as we talk about these cases. And combined injuries mean any kind of radiation exposure or contamination combined with physical trauma or thermal burns. Let's look a little bit at radiation injury and illness and at what level it occurs. From 0 to 1 gray or up to 100 rad, the symptoms, there are no signs and symptoms as a matter of fact. However, there is plenty going on down to 5 rad. Lymphocytes, which are responsible again for the immunological integrity of our body, are destroyed. They're very sensitive. They're very radiosensitive, and we can see changes in them occurring down to 5 rad. So under 1 gray, there are many things going on, particularly with the lymphocytes. Above 1 gray or 100 rad, up to 800 rad or 8 gray, the hematopoietic syndrome will be manifest with a gross depletion of lymphocytes in the circulation. In fact, we use the depletion of lymphocytes in the blood as a dosimeter, actually as a biodosimeter. Respiratory symptoms begin at 600 rad or 6 gray and above. Gastrointestinal symptoms begin at usually 800, but they may be manifest at 600 rad or 6 gray. At very high doses of 30 gray, we'll see cardiovascular or central nervous system syndrome, and above 8 gray, local dose, as opposed to total body irradiation, as the other 5 above are. The cutaneous damage begins to be manifest at about 800 rad or 8 gray. Settings for human exposures, as we'll see in a few of the accidents that I'm going to talk about, can occur just in the environment. They can be experimental, as I'll mention a couple of them, medical situations, medical treatment, diagnosis and therapy, occupational setting outside of the medical, outside of medicine, and of course in nuclear facilities. The International Atomic Energy Agency defines, or rather categorizes, radioactive sources into these 5 categories. They talk about radiography techniques, analytical techniques, irradiation techniques, techniques involving unsealed radioactive materials, and miscellaneous techniques. And these are categorized this way because of the relationship to the number of victims that might be caused by conversion of those materials to illegal use, or by how many victims might be caused by a particular type of application of radioactive materials. So I'm going to go through these and talk about a few of the accidents as we go, and then I'll summarize the entire accident history according to the definition that I just showed you at the very end. But I thought it would be interesting for you to see some of the results of radiation accidents and the symptoms that they cause, symptoms and signs they cause in human beings. We'll first look at industrial gamma and X-ray radiography, or sometimes called non-destructive testing. Radioactive materials are used for this just as many other kinds of physical energy sources are used for radiography. I'll talk about a little bit about non-destructive testing using industrial gamma and X-ray sources. These sources are usually cesium-137, iridium-192, or cobalt-60, and depending upon the application can be huge sources, 70 kilocurie and above sometimes. Let me show you what happens with the skin before we go into one of these cases. At 3 gray or 300 rad is a threshold for skin signs, and usually that begins with redness. Epilation, or the loss of hair, begins at about 300 rad or 3 gray, but it usually doesn't occur until about 15, 16, 17, 20 days. At 6 gray threshold, some erythema may be seen, but this erythema, I mentioned, I didn't put it on the slide up above, the erythema or reddening of the skin seen at the lower dose is very fleeting. It may be there and then disappear. However, at the 6 gray threshold, 600 rads, erythema is not transient. It lasts somewhat longer. At 10 to 15 gray, or 1,000 to 1,500 rad, we see desquamation. Desquamation coming from the skin, the part of the skin called the squamous epithelium. Squamous meaning sheets. So desquamation is the sloughing of skin in sheets. It's dry. That means there's not true cellular damage to the cellular membrane, that is, at that dose. But at 20 to 50 gray, there is cellular damage. The membranes are damaged. Proteins and fluid leak out of the cells, and we see the wounds becoming moist. This is usually 2 to 3 weeks after exposure, of course, depending upon the dose. And for the record here, the injury that is caused is dependent upon 3 things primarily. It's upon the dose, that is, how much radiation is delivered to the tissue. It's also related directly to the dose rate, and it's also related to the volume of the tissue irradiated. Here's a few of the common gamma emitters. Cobalt-60, we're going to talk about a case of that with 3,100 rads per minute per curie. These are fairly strong sources in very small quantities and are particularly dangerous in the occupational environment. We're going to talk about a case here of a 37 curie source, and let's just look at the surface dose at the skin from the incident or the accident that we're going to talk about here. Surface dose, 36,000 rad per minute, or 36 gray per minute. At 1 centimeter, 24 gray per minute. 2 centimeters, 6 gray per minute. 3 centimeters, 2.67 gray per minute, or 267 rad per minute. And I'm going to talk to you just very briefly about a case from Yanango, Peru, which occurred in 1999, in which REACS was called to consult. In fact, went to Lima, Peru, to the cancer hospital to consult concerning this man's injuries. This photo shows a pipeline that is outside of Yanango, Peru. It feeds the hydroelectric plant outside of Yanango. It's about 2 meters in diameter. This pipeline had to be shut down for repairs. During the welding process, the integrity of the welds were checked with industrial radiography using an iridium-192 source in a gamma camera. I'll show you a picture of that a little bit bigger when we get in just a moment here. At any rate, the welds in this pipeline had to be checked for their integrity. The radiographers went to lunch and left their gamma camera sitting outside the pipeline. Unbeknownst to them, a welder came back to the scene, was going to do some work, and saw the pigtail, which you see in the upper right-hand corner here. This is the pigtail. It's about 6 inches long, 8 inches long, and it fits onto the box that carries the cobalt or the iridium source, connects via that mechanism. There's the top of the box in the middle here. At any rate, that pigtail became disconnected. The welder saw it laying on the ground. It's so small, the source is at the very end here. This is about a 37 curie source right here. It's about half of its size or a third of the size of a pencil eraser. And there's, of course, obviously no way to mark this thing with a radioactive symbol. Furthermore, the folks in the forests of Peru are not necessarily literate. So even if he did see, let's say, the box, he may not have known the international symbol, the trefoil, for a radiation hazard. At any rate, this welder picked up the source, put it in his baggy trousers, which welders use so they can squat. They sometimes sit down on the ground or on a stool. They put their legs underneath them to get comfortable while they're welding in place, especially if you can imagine a 6-foot pipe that has to be welded. Picked up the source, put it in the side pocket of these baggy trousers, and then welded for 6 hours. Remember the rate now, the dose rate with this source on the skin or 1, 2, 3 centimeters away from the skin. Here's what his injuries looked like on day one. This began in the evening of 19 February, 19 February. Just some redness and a little bit of swelling. This is in the car in which he arrived at the Lima hospital. Now this is day one. Remember I told you that a wet desquamation does not occur until you get up to very high doses. This is day one. I also told you that it doesn't occur for 2 to 3 weeks. If you can figure back to what I told you about dose rates, can you estimate what his dose might have been just from this? This is about 2.5 to by 3.5 centimeters of this blister. This is the size. Here's after a couple more days to see how this thing looks. See the redness and the swelling around it? This is an MRI scan of his thighs. Notice the difference between his right thigh on your left, actually here. Notice the difference in size, almost a third the size of the other one. Look at the swelling and the loss of margins between muscles. There's so much fluid leaking out of the cells because of the radiation damage that there's massive swelling of this man's thigh. Of course, at these doses that this man has, the damage to the inside of the vascular system is extremely great. The vascular system is lined with endothelial cells, much like epithelial cells in skin. The endothelial cells of the blood vessels are very radiosensitive. If they're damaged, fluids leak out, proteins leak out, and thus we get the edema or the swelling of this man's extremity like this. His sciatic nerve and major artery going to the leg are there, and of course the inside of those arteries are extremely damaged. Here's only 10 days later. This is wet desquamation. You can see the swelling. I'll show it to you a little bit better a little bit later on, but this is a wet lesion with fibrin deposits. There are bacteria growing in there. This is a super infected wound, and this is only 10 days old. Here's 3.5 weeks. On 15 March 1999, we're now seeing even more massive swelling. We're seeing necrosis at or death of cells at the edge of the wound. Here's the wound at about 30 days. You can't really appreciate the swelling here because of the way this man is laying. And this is now the beginning of deep tissue necrosis. In fact, this wound is going to go clear to the bone such that the bone will be damaged. Here's 3 months in May of 1999. Now, I'm not going to go much further with these pictures since I'm in an engineering colloquium. But this man was shipped off to Paris, France, to a military hospital in this summer, or the summer of 1999. A guy who spoke no French. He had no family with him. It was advised by our REACS physician, Dr. Ronald Goins, who is an alumnus of the University of Tennessee Physics, was the physician on call. He's my predecessor. He was the physician on call for REACS. He recommended that there be disarticulation of the hip because of the progressive, the nature of the spread of damage to the insides of the blood vessels. They did not do that in Peru. They shipped him off to France. Here's the poor guy in France. He eventually has his hip disarticulated. Eventually they do what is called a hemipelvectomy, removed half of his pelvis, or a third of his pelvis. Of course, he has bone marrow damage because of the amount of bone marrow in the pelvis. Of course, his rectum, his great intestine, his gonads, testicles are seriously injured. And he is finally sent back from France to come back to rehab in Peru. Here's an isodose curve of, this is just calculations from one of our software programs. A dose of 50 gray within about 3 centimeters or 4 centimeters of the outside of the skin. That's what kind of dose this man had, and the reason for the subsequent total tissue necrosis in that part of the thigh, and the reasons that he eventually had to have the disarticulation. In the upper right-hand corner is Dr. Ronald Goins. This is the other experts from around the world, from IAEA and Peruvian doctors, trying to figure out what to do for this man. At this time, as you can see by the x-ray of his pelvis back here, he still has his right femur, he still has his pelvis. There's his femur, he still has it here. Of course, this is in May of 1999 before he's sent to Paris. Let's go on to some analytical techniques here. X-ray fluorescence, electron capture. There are a bunch of different sources, and again, we teach doctors and nurses about this because for emergency planning, preparedness, and response purposes, physicians and emergency planners need to know what kind of hazards in the area, what they are. It doesn't make any difference whether they're biological hazards, chemical hazards, radiological hazards, nuclear hazards. They still need to know what they are. So we give them these kinds of guidelines on which to sort of get a feel for what might be in their area. Let's look at X-ray fluorescence. X-ray fluorescence or fluoroscopy is all used daily in hospitals. The most common use has been over the years for cardiac angiography or looking at the blood vessels using fluoroscopy and a special dye. With an inappropriate dose, we can get not only erythema of the skin, but this is what is called telangiectasia. This is actually this is an overgrowth of the capillaries and the venules and the arterioles in the skin. This is one where the man got a little bit too much of a dose, and the dose here had to be probably 30 gray. This is with the camera to the front of the, shooting from the front to the back. And these skin lesions like this will last for years. There's another one, again, fluoroscopy from some fluoroscopic chest procedure, or it could be cardiac. Another one. Even those things, these will heal up, they will come back for decades and cause difficulties for the individual. Let's go to some irradiation techniques. Most of you have heard about teletherapy. Here's a common camera used for teletherapy. Here's another a linear accelerator camera. It's commonly using high-dose teletherapy up in the 50, 60 gray, but fractionated doses, so we don't get the skin damage, the other tissue damage that occurs at those high doses. Fractionation of the doses, as is used in radiation oncology, significantly diminishes the damage that you would see were the total dose given at one time. Brachytherapy is planting of seeds or pellets of material into a tumor, usually solid tumors. Iridium-192 is a commonly used one for solid tumors of the pelvis. These doses are they're strong sources. They're placed into an applicator tube. The pellet is put into a tumor and left for a period of time and then retracted through a tube into the source protective shield and transport mechanism to move the source around. Radiation sterilization is another very strong source, or one of many of the techniques using a very strong source for irradiation for various purposes. In this case, I'm going to talk to you a little bit about a radiator accident in Nezvizh, Belarus, or Byelorussia, occurred in October 26, 1991. This is a type 2 gamma irradiator. It's a dry storage design, a Pepple model which was made in the former USSR. It was a 30, I can't figure becquerels like that. I have to think in kilocuries. 800 kilocuries of cobalt-60. This can be used or was used for sterilization of peat. And the reason for that is at the doses used, there were 2 passes in the machine that we're going to take a look at that gave a total dose of 24 kilocurie in 2 passes. That dose was sufficient to kill everything that lived, viruses, bacteria, fungi, and in a peat moss or peat fertilizer, you want to make the organic material, you want to kill it so it does not begin to ferment and grow and destroy the peat moss. At the time of the accident the machine was being used for sterilization of medical syringes and hemostatic sponges at 760 kilocurie source. Here's a look down at the floor plan of the source. Now the source rack is right here. This is the source rack, and this source rack is made of 1 by about 10 centimeter cobalt-60, and it is stainless steel clad. The source and the source rack sit inside the building itself. These walls are 2 meters thick, or variously 2 meters thick. In order for the operator to get inside this irradiator, he has to come through this door right here. There's an emergency stop button, which would make the source rack and that cobalt source drop into the floor and into the non-irradiate position. But there are many safety mechanisms built in here. In the floor is a drive motor for the floor. That floor pulls back. When this source rack is in the up position to irradiate the materials, this floor moves such that there's a pit here that you can't climb over, you can't jump over. There's also a pressure plate here that someone, if they stepped on it, the irradiator would automatically drop into the floor into the non-radiate position. There are also a number of other alarms here, and alarms for ozone and oxides of nitrogen, which are caused by this strong source. But in this particular case, this gentleman bypassed all of the safes and got into this facility. It's still not been figured out why. Even the IAE document, which is the final word about what this accident was all about, does not even have they haven't even figured out how the man possibly got in there. Unless he'd gotten in there and somebody then triggered or reversed all the safe position. Here's a side view. Here's the source rack here. This is a source rack. And there are counterweights over here. This is a counterweight here. Chains here connecting the source rack to the chains. When this is to go into irradiate position, these counterweights come down. It goes up into irradiate position. And here's what they're going to you're going to see when you get into this facility. Over here you can see one of the irradiator boxes. There's a better picture of it here in just a second. But behind this is the source rack. Here's that pit I was just talking about at the entry. After this case was over, the company was required to make that pit deeper and longer front to back so that nobody could possibly jump over that and get into the irradiator source. Here's looking down into the source pit. Here's the counterweight. This is in up position, and down here is the source rack where the cobalt source is. Here's a conveyor system. These boxes are about a half a meter, 500 millimeters from side to side, and about twice as high. These are on axles here, and there are two passes. So these, they go one pass, and then they flip the cradles. These boxes flip upside down, and they run it through again to give it the 24,000 curie. Here's the distribution of the carriages inside the chamber. Here's the position that the gentleman was probably in when he was trying to fix a jam in the conveyor mechanism up here at the top. Here's the source over here. This is a mock-up, but the source is over here. The man is reaching up to fix this jam. The source is right back here at about 1.5 feet or 2 feet away from him. Here are the dose estimates from electron paramagnetic spin resonance, showing maybe 14.5 gray to the teeth, anywhere from 11 to 15 or 18, 12.5 gray around his torso. Now, I'll tell you, we're not going to get into it so much here, but 10 gray is about the limit of survivability for total body irradiation. All right? Even, and of course that goes down, the threshold for death goes down with intercurrent illness, extremes of age, and this man's injuries and illnesses from this kind of a dose are not survivable. Here are the skin lesions that occur. Actually, these skin lesions, like these and like these, are not only erythema from skin damage itself, but from the vascular damage, the capillary, arterial, and venal damage that occurs from this kind of a dose. Also, there are blood effects with damage to platelets, which can help control clotting that make for some of these changes. Here's cutaneous changes. This man's, we're actually looking at this white stuff here. If you remember, I was talking to you about lymphocytes that are killed in circulation. Lymphocytes are responsible for controlling immunity. If you knock off or kill too many of the lymphocytes and a lot of the bone marrow, in about 7 days or even less, viruses are going to be the first to infect. And usually it's going to be herpes simplex virus, sometimes cytomegalovirus, And of course, fungi come along with it. And any of those of you who've had kids have had the kids with thrush of the mouth. This is candidiasis. Ordinarily would never occur in an adult unless they're immunocompromised, perhaps from chemotherapy or radiation therapy. You can see some more skin lesions here. He's got a central line in here for parenteral nutrition, because at this dose, this man started vomiting within 5-6 minutes. So he was incapable of eating or drinking for the entire time that he survived. Other skin changes on the legs, consistent with burns as well as vascular damage and damage to the production layers of skin. That man died at 113 days, which is an incredible survival period of time. Most people without treatment, the LD 50-60, the lethal dose 50 in 60 days, is around 350 rad, 400 rad perhaps, or 3.5 to 4 gray. This man survived a dose that was probably on the order of 11 to 12 gray total body. This was survival to 113 days was indeed a fairly unbelievable. Irradiation is also used for food preservation, but it's different than sterilization. It's used for peat moss or for medical supplies, syringes, and that sort of thing. For food preservation, if you give too much radiation, you destroy the foodstuffs. You destroy the vegetables, the meats, the fruits, and so forth. But these irradiators are about the same as the other ones, but except the doses are much, much lower. Let's go to radioisotope tracer techniques, most common one in the past, and from which there have been many injuries, but not really significant injuries that we're talking about. With technetium meta-99 has been the most common, but many other radionuclides have been used for in vivo studies. The new technique over the past 10 years or so, PET imaging using positron emitters, fascinating technique using very, very short-lived radionuclides that are artificially manufactured with a cyclotron, like F18 with a half-life of 110 minutes. These are tagged to something like glucose. So we get 2-fluoro-18, 2-deoxy-D-glucose, which is the body recognizes as a physiological substance. The body uses it as a sugar. So the cells that are cancerous actually have an increased, what are called hexokinase enzymes, which actually utilize glucose to manufacture energy. And these, as they're metabolized, they are sequestered intracellularly, inside the cells, such that you can see hyperactivity in many tumors. It's a marker of cellular glucose activity, and it accumulates primarily in brain tissue, stomach, spleen, and when coupled with CT scans or MRI scans is a wonderful way to identify function, that is how an organ is working as it relates to structure, that is where it relates to where in the body the activity is ongoing. Let's look at therapeutic uses of radiopharmaceuticals. I-131 is the most common one, treated for hyperthyroidism. These are 40 megabecquerel sources, 1 millicurie is typical. Self-luminous devices, which are another unsealed radioactive material. Self-luminous devices usually using tritium, sometimes krypton or usually tritium. An alternative to the to the gas in the container is a luminous paint alternative tritiated polystyrene. Thorium, another unsealed source of radiation and found many times in lantern mantles, however has been replaced primarily by lanthanum, and it has some other uses too. This is a common problem we find over the years, and REAX has been called to help treat folks who have had rat poisoning from thallium, since we carry Prussian blue, which is a treatment to remove thallium and radiocesium from the body. We have often treated thallium rat poison cases with our Prussian blue. Number of other sources. These are not particularly of concern from a medical point of view. Nuclear batteries are quite interesting though. Static elimination using 210 polonium. Smoke detectors used to use radium, now we use americium-241. The domestic sources are much smaller than industrial sources, are rarely a hazard except in an occupational setting. Nuclear batteries are particularly fascinating, and we at REACT are doing the training for the NASA DOE project for the deep space probe called New Horizons Pluto in January of this year. And the only reason I bring this up, you'll see at the back of this satellite is an RTG, a radioisotopic thermoelectric or thermonuclear generator. This thing, because of the types of metal in it, actually acts as a thermocouple to produce current. At the same time, the material, the plutonium that is used in the RTG, is creating heat. So at the same time we're generating electricity from this device, we're also generating heat to keep the equipment operating properly. Here's what one looks like. I couldn't get a very good picture because I have to copy them off the NASA slides, but this is a picture of one. There are multiple elements of plutonium oxide in this device, and there are 3 of these heat generators or heat gadgets that collect the heat, 3 of them for every plutonium oxide nodule, or node I should say. Here's the deep space probe to Saturn. See how big the folks are here? Now the odds of a significant development with this kind of RTG, in the previous launches the amount of plutonium was on the order of 300,000 curie. This year, or this next year, is going to be on less than 150 or 125 curie for 1 RTG versus 3 on the Cassini probe last year, or I mean in 1997. So where do radiation accidents occur? I talked to you about irradiation facilities, nuclear reactors and facilities, isotope production facilities. All of these can be wherever these materials are used or manufactured, where they are utilized for their industrial or consumer purposes, the events can occur. This is one way that the accidents have been divided up into or categorized. Criticalities, this is over 60 years now, a total of 427 events. You can see 12, maybe 19 criticality events using radiation devices, sealed sources, X-ray devices, and so forth. About 3/4 of those 427 cases. Does this have any draw your attention to something fairly significant here? Almost a half of these accidents have been caused by sealed sources. Those are ones that radiographic sources, of which there are 1 million in the United States, that can be picked up and moved around. Not only like the welder in Yanango, Peru, getting the source in his pocket, but it can be converted to mischief. In fact, several years ago, it's actually about 5 years ago, during the semi-quarterfinals in Greensboro, North Carolina, I believe it was 13 cesium-137 sources were stolen from a hospital or disappeared from a hospital in that city and have not been found to this date. These sealed sources are easy to carry around. They're easy to get into, to have somebody convert into some sort of mischief. The other problem here is, you might note, is the 82 X-ray devices. Now those can be X-ray devices used in for medical purposes, but they can also be industrial, non-destructive testing X-ray devices. Here's a frequency distribution of major radiation accidents by device in these past 60 years. Criticalities in the green, radiation devices in magenta, and radioisotopes in bright red. Notice the climb in the radionuclide, or the radiation devices, this line going up here. Anybody have an idea what that might be from, or might have been due to? In 1973 was the oil embargo, and it was known at that time that the United States was going to have to gear up with petrochemicals, and began gearing up with many, many petrochemical facilities. Well, as you can imagine, every pipe weld and every vessel in every refinery had to be checked for integrity with radiography. So, with anything in which humans get involved, the number of accidents that resulted from radiation device use rose dramatically. And then when the IAEA began to get very serious about investigating these accidents, the accidents dropped off significantly. Look at criticalities here. 3 criticalities back in 1944, 45. I remember it well. 3 of them, Los Alamos, 1944, 1945, and 1946. And we'll look at a couple of other criticality accidents here. If anyone remembers the last one, 1999, Tokai Miura, Japan. 2 of 3 workers in a a uranium processing facility. Because they didn't follow the rules, 2 of 3 died from a criticality and significant gamma neutron dose. Radioisotopes, off and on, up and down. It's again because of the increase in the use of radioisotopes for medical purposes increased dramatically. However, our safety programs have significantly improved. Let's get to the meat of this. The number of accidents in 60 years, 427, 134,000 folks involved, 3,050 significant exposures. Again, that's that NRC definition. Total fatalities, 134. Now, there are what we believe, the numbers down here from the former Soviet Union. We believe 137 deaths, 507 people involved with significant exposures, 278 and 35 deaths. However, we know that in the registries in the world that there are a number of deaths or significant accidents at the shipyards in Gdansk, Poland. Probably dozens have not been reported. Iran and Iraq have also had some injuries that we do not hear about, we cannot get information about, and some in the former republics of the Soviet Union. Let's look at U.S. versus non-U.S. And what the thing that jumps out at us here is primarily this number that are non-U.S. cases. U.S. cases where fatalities were only 30. Outside of the U.S., 104 fatalities for a total of 134 plus another 50% or 100% for cases that we don't know about. What do you suppose this is the result of? It's the result of 2 or 3 things. One, the major one, is, of course, Chernobyl, the meltdown of the reactor in Chernobyl, former USSR. There's also 10,290 some victims as a result of a strontium-90 waste dump explosion in Kishtym, sometimes called the Causley accident. Thousands of people involved in that. A number will die because of radiation-related cancer later on. Not a significant number of deaths at that time. The other major accident here is Goiânia, Brazil. A cesium-137 teletherapy source that was not controlled by the company that owned it. Was found by a native and taken home, and it was noticed to glow in the dark. Because of Cherenkov radiation, the moisture around the cesium-137 made it sort of mystical to them. So these folks would take that material, it was crushed up or broken up, and a 7-year-old girl died as a result of playing with the cesium-137, eating at the same time over a day's period of time. As a result of that cesium being used by folks because of its magical qualities, they paint themselves with it and it would glow in the dark. As a result, 4 people died in Goiânia. From an emergency planning, preparedness and response standpoint, the authorities in Goiânia, Brazil screened over 100,000 victims of this event. 4,000 exposed, dozens overexposed, 20-some developed acute radiation syndrome, all survived. 1 7-year-old girl dead because of that accident. Let's just look at, here's the accidents if we look at the United States versus other countries in the world. Let's look at non-radiation deaths, and I'm not going to dwell on these so much, but let's just look at one of the events here. Idaho, the date's 1961. The place is north of Idaho and a defense early warning system. unit. There were 3 men stationed there with an RTG, which has variously been controlled to research radioisotope thermoelectric generator. Actually, it developed steam. It had only one control rod, and although we're not going to talk about criticalities today, many of you are familiar with that, it had only one control rod. The only thing that we can figure out that what happened is that control rod malfunctioned, and a man was bending over it trying to get it unstuck, and he pulled it out too far, and criticality was reached in nanoseconds. Criticality occurred, however, the heat generated actually made the unit explode because of the steam. This is called a non-radiation death because, well, if the 3 who were there had lived long enough, they would have died from the exposure from the criticality. But they're non-radiation deaths because they were killed by the trauma of the explosion. In fact, the man who was bending over the one control rod was actually pinned to the ceiling. SL1, yes. What did I say? Oh, okay. SL1 is exactly right.
But they're not counted as radiation deaths. That's interesting because they were hot.
Oh, they were hot. Oh, they were hot. They were so hot that they couldn't even been brought out by emergency response crews. They could go in and see where the bodies were and get out. And then because they were, I think it was 10,000 rad per minute, something like that, inside this facility. But 3 deaths in the SL1 accidents, northern Idaho in 1961. Let's go on. We won't talk about the other accidents here. In fact, we could spend hours on all of these. Let's look at the United States deaths. New Mexico, I mentioned those. Those were 3 criticality deaths at Los Alamos in the early or the mid 40s. 3 criticalities there. In Ohio, there were 10 medical misadministrations of cobalt-60. The wrong graph paper was used by the medical physicist to calculate the dose. What eventually occurred was if the dose is underestimated, the time of exposure was increased. 10 people died at Riverside Hospital in Columbus, Ohio. Oklahoma, 1 teletherapy source, 1 death from a teletherapy source. This is thought to be a probable suicide, and a radiographer who took his radiography source and somehow put it in his pocket and put his arm over it and kept it there for a period of time, eventually causing acute radiation syndrome, significant burns to his chest and his arm. No history of previous mental illness or any reason for this. However, the mechanism of death and the placement of the radiographic source just was incongruous. In Pennsylvania, this is actually in Indiana, Pennsylvania, an elderly woman in a nursing home was getting therapy for a rectal or an anal tumor. She was getting brachytherapy with 3 seeds of cobalt-60 inserted into the tumor. When the brachytherapy source was pulled back through the applicator tube, one of the seeds was left in the tumor. The applicator tube was pulled back into the brachytherapy transporter, and in spite of alarms going off all over the treatment facility, the brachytherapy transport was moved. Later that night, a nurse's aide came by, found some material in the lady's bed, put it on the bedside stand, left it there for a while. Early on in the morning, another nurse's aide came in, saw this material, put it in the garbage, and eventually got put in the garbage. This is Thanksgiving, on a Thanksgiving weekend. It was eventually got to the garbage, put into a storage room back behind the nurse's station, and sat there until Monday morning. All right, so now we have probably dozens of folks, nurses, aides, physicians, and so forth, who are being exposed to this source that is hidden there and nobody knows it's there. A truck eventually picks this material up and drives off to Ohio to a waste facility or waste incinerator. The alarms go off at the incinerator, meaning that they have radioactive waste or something radioactive in the truck. They send the truck back to Indiana, Pennsylvania. Finally, the Nuclear Regulatory Commission gets involved, and a major investigation occurred. This lady died in 3 days from a dose, a significant dose from this cobalt seed. Rhode Island was a criticality. Texas, there were 9 deaths. 2 were related to a Therac 25 teletherapy source. This was a 25 megavolt teletherapy piece of equipment. It had what was called malfunction 54. It is an onboard software problem which resulted if an operator keyed in a code for a shutter setting, a time, and so forth. If he or she made a mistake and then corrected the mistake too quickly, the machine did not pick it up, and if you hit the on button, what happened is the shutter would open wide, and two people had cranial injuries and brain injuries from 25 megavolt. And I have the pictures embedded in here, but I didn't want to show them. But the track through the brain at autopsy was clear from that huge bolt of radiation. 7 died in Texas, in Houston, when an yttrium-90 source that was attached to microspheres used for treating liver disease became detached, and the doses over a period of time, over months, so it was significant enough to cause 7 deaths. There were a total of 450 people involved in that miscalculation. In Wisconsin, there was one death because of a medical misadministration of gold 198. The miscalculation was from instead of microcuries, it calculated millicuries and resulted in 1 death. So this is not, from my point of view as a physician, is not very heartening, realizing that I've got 10 deaths, 11 deaths, 12 deaths, 21 deaths, 22 deaths out of 26, or 80%, because of medical use of radioactive materials or radionuclides. Won't spend a whole lot of time on this. We've got just another minute. We've talked about, well, there are 100 non-U.S. cases. Algeria was a lost source, sealed source. 2 deaths resulted from that. Belarus, I already talked to you about that, was an irradiator accident. Brazil was the Goiânia case, the 7-year-old plus 3 other folks, that because of a cesium-137. Egypt was a lost source. Again, major injuries. Meat Halfa, Egypt was a major injury. El Salvador was an irradiator case. Again, one of the major sources. Estonia was a stolen source. Israel, Sorvan facility in Sorek, Israel, was an irradiator, again, an irradiator facility. Italy was an irradiator facility. Norway, an irradiator facility. 5 deaths, at any rate, in the world in 60 years from these major irradiation sources. If we look at other events, Belarus was the other irradiator source. Criticalities, Japan too. At any rate, I think I'll stop there and ask for questions, if you will. As I say, we could go on for another few hours.
Okay, Mario?
Yes, sir.
You said there's some subtle doses at 5 rem. What's your opinion on the non-threshold linear?
I was afraid somebody was going to ask that.
Can't bring it up now.
No, you can't take it back now, and I have to answer it. I really have my doubts about it. We know that we have just from, if we look at cytogenetic biodissymmetry, normally we'll find 1 to 1,000 metaphase spreads, we'll find 1 chromosome abnormality just in everybody. It would seem to me that you'd have to figure out, if you have no dose, would you have 0, or would you have a spontaneous mutation, or spontaneous mutations, or spontaneous aberrations for other reasons that are not external to the human. I happen to believe, I don't really believe that, but that is not my field, and I will not say that I'm expert in those matters, and I will not be held to it. All right, sir.
Okay. Do we have other questions or comments from the audience? Okay. Well, let me remind everyone that we do have a reception downstairs, and everyone is invited. But before we adjourn for our reception, let's express our appreciation to Dr. Christensen for his presentation today.
Thank you. Thank you. Thank you, sir. I hope it was enjoyable.
Lots of information.
It's not really